Hi, good afternoon. My name is Christine Emery, and welcome to the last panel of the Hero's Journey Symposium for 2020. I'm a longtime supporter of the John P. Mayhew Foundation and the JPM Foundation. In short, it connects the dots. That's what we do. We work on building collaborative relationships between the private and public sectors. We believe this is the best way to shape the pathways for mental health recovery, pathways that are sustainable. As our facilitator, Kathleen Koch, well knows, a before the disaster blueprint builds much more resilient communities. Kathleen, former CNN anchor and founder of LeadersLink, will engage our two special panelists in a conversation, exploring the paths from wounds to wellness and building the bridges between public and private sectors. Brandy Scardo is executive director of the SAFE Project and a person in long-term recovery. She has an amazing ability, long track record of building relationships and bridging gaps among behavioral health, community services, and criminal justice systems. Joining Brandee and Kathleen is Tom Mutryn. Now you might ask yourself, what is the Executive Vice President and CFO and Treasurer of CACI International doing here? He and his wife founded Mike's Place after losing their son in 2014. As we've learned today, and if we learn by reading and looking around us, losing a family member to addiction can happen to any one of us. I need say no more. Their bios are in the program. So please join me in welcoming our distinguished speakers this afternoon.
Thank you so much, Christine, and we're really honored to be the last panel. Save the best for last, I guess. Then thank you, Tom and Brandee, for joining us today. And I think it's really powerful that you have very personal reasons for being part of this important effort, this vital effort to really help people who are struggling with substance use disorder. Brandee, I'd like to start with you. Talk to us about your personal journey from addiction and how it has carried you now to be executive director of SAFE Project.
Thank you. I had to joke with you earlier. Do you have all day? Because it surely has been a journey. So I appreciate you asking that question. As was mentioned, I am a person in long-term recovery. And I think for me, there is something to that because I have that lived experience. I started using at the age of 11. And quite often people think that it's in high school and things of that sort. But my addiction really started to take off at the age of 11. It blindsided me. I had no idea that I was going down this dark path. It subsided a little bit. I ended up getting married. I had 4 children. But I found myself I said to myself, I'm never going to do these hard drugs. I'll never do the hard drugs. I never thought I was an addict. I always thought that I could handle it, that I could really get through this. And I found myself in a jail cell. I found myself with 4 concrete walls around me. And I'm very open about it. I was facing 11 years in prison in Maryland and a year and a half to 4 years in prison in Pennsylvania for some backup time. And I knew something had to change. I knew something out there was better. How could me, a mom of 4, really just searching for that dream of having my home, my husband, my house, my everything, just be gone like that? And it was interesting because it happened very organically in the beginning behind those walls in that prison cell. And I started talking to the other ladies there. And one of the first things that I did was I asked for treatment. I said, I really, really need help. Obviously something's wrong.
And could you get it there in prison?
I could not get it there in prison. I was lucky enough that they transported me from prison over to a treatment center. So I was transferred over to the treatment center. And that was where I found people like me. You know, I felt for so long shameful, guilty.
Like it was a character flaw,
Like,
and
yeah.
not a medical
Not
illness.
a medical condition. It was a character flaw. There was just so much shame in that. My family, I felt they were so ashamed of me. My children, I just felt like I couldn't get it together. But I will tell you, Kathleen, when I went into that treatment center and I was around other people like me, and I learned about the disease of addiction and that it wasn't a moral failing, just something changed, something clicked. And I started to learn about the disease of addiction. And what I found was, for me, I had to go back out into the community and do service work. And that's exactly what I did. I went back to treatment centers. I mentored young women. And from there, I found myself actually saying, hey, I want to work in this field.
So tell us about SAFE Project. I mean, it's an extraordinary organization, and how is it different from other organizations that do focus on substance use disorder and really helping people?
So I think it's different from my perspective. Having my professional career in behavioral health, quite often in nonprofit organizations, we work on one specific thing, whether it be treatment or recovery, prevention. SAFE Project is unique because it works on everything. And I know quite often everyone says, well, you all do too much. Well, for me, we don't do enough. We work on safe campuses, safe communities.
You have some slides you wanted to show us?
I do.
Okay.
I do. I get so passionate about my organization that I forget to show you the slides. So, safe, and we can go to the next slide. Please and thank you. There we go. So SAFE Project was actually founded from Admiral Winnefeld and his wife Mary, who lost their son to an accidental overdose. And they said the same thing, Tom, that you had said to me. If I had known then what I know now, things may have been different. And it was interesting to me because we have a family who has suffered a loss, and hiring an individual in recovery to lead that organization was the first sign of true collaboration. Quite often there's even silo between family members and people in recovery. So SAFE was born. And it's so unique to me because we don't operate under one purview. We know that in order for us to combat addiction, that we need to be in every aspect of the community. Like you had mentioned, that community blueprint. So if you could go to my last slide. Please hold while I tell my extension. You can go to the next one, I'm so sorry. There we go. So what we do is we have a matrix, and we are getting ready to add our safe workplaces as well. But we have 4 key initiatives, and 6 of those lines of operation run through those 4 key initiatives. Now we know that stakeholders' lenses or their interest is going to be different through those 6 lines of operation. So we build programs, we fill gaps and seams based on what is needed in the community. We are not there to duplicate services. We are not there to overrun other services, but we are there to enhance services and fill those gaps. And that really is what needs to happen for us as a community to come together and to start building that blueprint. So,
Thank you, Brandee.
you're very welcome.
Tom, will you share with us now your personal story? Talk to us about your son, Mike, and how you came to found Mike's Place.
Yeah, thank you for having me here this afternoon. We have a couple slides too, so if you put the first slide up, that would be helpful. Michael, unfortunately, died at the age of 23 on April 20th, 2014. I could go on about my childhood, how he was special, but at the end of the day, after he died, I spent a lot of time thinking about why. What was the root causes, and what could we have done? What could I have done differently to have a different outcome?
I think that's the question every parent asks.
Absolutely. It's and one of the factors among many was he was living on his own in an apartment in College Park, to the University of Maryland. And when he was transitioning to the University of Maryland, we looked for a kind of safe, supportive substance-free living environment, and was unable to find one. And as a result, he had an apartment by himself. He was on the men's hockey team, with a lot of kind of positive aspects, but not being part of a recovery community, not actively working his recovery 12-step programs, allowed him, I believe, to drift, and his story had a sad ending. What I believe is having safe, supportive housing is very important for people in recovery. And our focus was not to help large numbers of people, but a few select people who can reside in a supportive living community. Kind of Mike's Place mission, as depicted on the slide, is to help young men in recovery to develop essential life skills to allow them to reach their full potential by providing safe, affordable, supportive housing community. And the word I would like to stress is community. We're trying to create an environment where people help them teach others through a collaborative process.
Well, I think that's so interesting because you and I were talking earlier. You said that is what is different from Mike's Place versus an Oxford House or other residential facilities. I mean, this is very much like a family. There's a curfew, you have chores, there's accountability, there's supervision, there's structure that doesn't exist in other places.
Yeah, so the next slide gives you a couple pictures of the house. It's important for people again to feel that sense of community, sense of family, and here's a few pictures of the.
Those are beautiful.
The folks participating in a shatterproof, 5K race. And every Monday we get together and have a group dinner in positive interactions, and so I think that is very important to help people in recovery. And a lot of nice success stories. Since we opened the house 4 years ago, approximately 35 people have come in and out of the house. Some have been kind of wildly successful. Other ones, people relapse. But to my mind, we've helped all the guys who've come through the house. And one last slide, and then we can answer your questions. Just a photograph of my kind of dear son. Who was it? Hockey. And so we're doing this in honor and memory of him. And very similar to the last panel, this is healing for me, as well as support for the gentleman.
I think it's beautiful the way you and your wife are there on a weekly basis. You told me you had dinner with the young men, because again, you have really created a family there.
Yes.
How do you think that helps them?
I think it helps them relate to kind of adults who are not parents, because you kind of parent relationships, assuming that you have a parent who is still around, become complex. And so here are a couple older people, both in our 60s, who quasi serve that parental role, but at the same time, being kind of friends with them and people that they can relate to. And they're very aware of our grief, and they provide support to us. And so part of their healing journey is helping others, helping God.
I'm sure they don't want to disappoint you.
Yeah.
Right. Brandee and Tom, part of what we're doing here today with the John P. Mayhew Foundation is really looking for ways that we can create essentially a blueprint, so a community blueprint that can be followed to help better support those who are struggling with brain health challenges of all types, whether it's traumatic brain injury, post-traumatic stress, or substance use disorder. What are your thoughts on what that blueprint has to include, and is it important that it be tailored to every community, or does one size fit all?
I think it is extremely important that it's tailored to the community, because each community has different needs. What that looks like from my perspective, and I say this quite often, is for even individuals in recovery to move outside of that bubble and start having conversations with people of different discourse. I always talk about exposure therapy, for example, and I don't mean, going into a room with a snake. I'm talking about actually having these conversations with individuals who are in recovery. And Tom, I think that's one of the experiences that you have. And I will say that from another person in recovery, I think one of the things that you bring to the table is that you believe in us. And that is extremely important, that people believe in us, that we can and do recover. But I also think it's important for us, if we're going to go down to your local coffee shop and have a conversation with your barista, or if you're going to have a conversation with your congressman, that there shouldn't be shame involved in that. This isn't everyone's situation. Health and wellness isn't everyone's situation. So we need to start bridging those gaps between public and private partnerships, having those open and candid and honest conversations, and telling our stories.
But that's not easy.
No.
Is that, Tom, is that even easy for you to talk about Mike and about Mike's place and what you're trying to do?
Yeah, well, you can tell by my tone of voice, it's sometimes challenging to talk about my son after 6+ years. It's kind of very raw, emotional part.
So those aren't easy conversations. Tom, for you, what do you think when it comes to a blueprint? What should be included in that design? What does every community need?
Yeah, so I'll take a step back. So it starts with, in my mind, supply and demand. And so how can you reduce the demand, for substances? Part of it is education, going to the schools. This is your grade on drugs. It's important to kind of reach out to children at impressionable ages and share stories. And there's a number of great organizations that go into schools and tell stories. The supply of drugs, right? And kind of vigorous law enforcement. Fentanyl coming in from China is killing tens of thousands of people. Methamphetamines. We glamorize certain things on TV. Breaking Bad. How cool is that? Well, it's not cool. It's evil people. So focusing on, again, strict law enforcement. And then when people are in recovery, let's have good treatment protocols. And treatment is somewhat of an inexact science. People do phenomenal jobs of treatment programs, but there's no magic cure. And I know various national organizations are continuing to do research on effective treatment protocols.
I know we had a panel earlier this morning on children and mental health. How important is that we try to nip this in the bud before we're even getting to the point where we need the substance use disorder treatment? How do we get people at a younger age and people of all ages the mental health treatment that they need so they don't end up turning to drugs or alcohol to self-medicate?
Yeah. Brandee, I'll let you answer that question. I know it's a little bit too challenging for me.
Well, it's pretty interesting because even having dialogue with my own children, I think the first step is not being naive. And quite often we are naive. When we build programs for school systems, we typically will start off at the high school age. We're a little fearful about going into middle schools and elementary schools. That is very taboo.
That's an age where children are struggling.
It is
mightily, really.
That is the age where you can actually mold people, perhaps through social and emotional bonding. We at SAFE have actually started to develop a program to go into schools of children at a younger age. It's also important to start developing relationships where you create safe spaces for children.
Where it's okay to say you're not okay.
It's okay to say you're not okay. It's okay to say I'm depressed. It's okay to say I have anxiety. It's okay for us to explore that because anxiety and depression does not come out in children like it does in adults. So perhaps a child has a stomachache. Ask those questions. They may have a test coming up. They may have a presentation that they have to do. So how do we start to do that and how do we start to build coping skills? So our first go-to isn't the substance, but we can start to breathing exercises, meditation, I actually have a small bowl in my office, and my 13-year-old son will come in and see that I'm flustered, and he'll ding the bell, and him and I will just sit there and center our core. You know, that's something that we've experienced together, and he knows that if he's stressed, he can come and say something to me or utilize those different types of coping mechanisms.
But how many parents know that? So does that blueprint have to include really, mental health awareness training for entire families?
Tom, do you want to?
The answer is yes, obviously. And I think the good news is there is more of an awareness with regards to kind of mental health issues. In the stories I hear when I go to 12-step meetings are, I didn't fit in, and so I started using, and that allowed me to feel good about myself and to fit in better. And so in many cases that was a triggering event. So why did the person not fit in? A whole host of reasons. In some it's very clear childhood PTSD, traumatic events. Other times it's kind of random nature. And trying to break that preventative mechanism, I think, is really going upstream is critical to do, but no easy task.
Let's talk about collaboration, public-private partnerships. Brandee, how important do you think those are in tackling this issue and really shaping these sustainable pathways to recovery?
Well, as I mentioned earlier, public-private partnerships are imperative. Tom, your background, for example, just makes that point. CNN background makes that point. We're not here today by coincidence. I mean, there are things that have happened in our lives that brought us to this table. If we would actually start to engage in public and private partnerships without fear and apprehension, and start to understand the what's in it for me factor, and how does this affect me as a whole, whether it be through my business, whether it be through my church, my community, whatever that may be, we really need to start to synergize those efforts. One example would say for DEA, with COVID hitting. DEA used to do the take-back days. Well, they weren't going to do them anymore. So someone had to step up to the plate and say, hey, this still needs to happen, and we shouldn't have necessarily just 2 take-back days a year. It should be all year long. So we partnered with Doterra to give out the drug disposal bags. It's important for us to really navigate those partnerships and figure out ways to bridge them. And it's all not just about financial means, it's also about community well-being.
And I think that's so interesting you brought that up, because even during the pandemic, there are opportunities. I also, in my spare time, chaired an organization, the Howard County Community Organizations Active in Disaster, and we've been having dozens and dozens of public food giveaways. And one thing that the county health department did is they came to us and they said, hey, we have these Doterra bags. Could we give those out at the same time? Or would you tuck them into the grocery bags? We said, sure. So, it was just people thinking outside the box where we can't do what we used to do, but there's something else we can do.
Exactly.
What do you think, Tom? What have you seen in the way of public-private partnerships, and which side is it that least understands how important this is to them? Is it the public side or the private?
No, if the public side, if we're talking about kind of government agencies, there's a variety of kind of national agencies, NIH, or different aspects of kind of NIDA, who do phenomenal kind of work in terms of advocacy, in terms of research, in terms of education. There's a large number of kind of wonderful not-for-profit organizations operating on a national level, trying to influence public policy. If anything, my observation is perhaps you're a bit fragmented. With the number of organizations out there, do they know each other? Do they collaborate together? Do they pool resources effectively? And perhaps there's a way for kind of the private organizations to think more about collaborating, kind of treatment centers. How can they work collaboratively? How can they share best protocols and the like? But I think both parts of the problem solvers are sincerely trying to make them a better place.
Speaking of the public sector, I know when you and I talked, you expressed some frustration at navigating local government rules and regulations. What changes do you think we need to see there to help more grassroots operations like yours thrive?
So housing is what I care about, obviously, and we wanted to create a kind of recovery house. And one of the very first questions is, well, I'm going to put in this particular neighborhood. Is there any zoning issues that I need to deal with? And the zoning rules and regulations are both complex and ambiguous as to kind of what is permissible, what is not permissible. I'm working with another organization doing a similar type of housing in Leesburg, Virginia, and very much of a gray zone. So this organization is going to go forth and open this house, but it's not clear whether it's okay to do so. And so let's do it and let's see what happens.
Ask for forgiveness later.
Yeah. And so I think having better clarity from kind of various municipalities would be helpful to do that. You mentioned Oxford House, a great organization that broke a lot of ground with regards, allowing, housing, for people in recovery at various local jurisdictions.
But I tell you, that means overcoming the NIMBYism, right? Not in my backyard, and the stigma.
Yes, and that's certainly understandable. Hey, we're going to have a house next to you open up, and we're going to have 6 addicts live next to you. How do you feel about that? And most people would not view that positively.
But Brandee, doesn't it go back to what you said earlier, the whole exposure therapy? Maybe if people knew someone who was in recovery, then they wouldn't feel so upset about it.
I'm sure you know, that's a gray and fine line there. Quite often, if even in that predicament, if someone is successful, well, it's only you, it's not everyone else. You're a little different or a little unique, or you're advanced in your recovery. It is extremely hard. And when we talk about the public-private partnerships, having those conversations where we can actually get a house in a neighborhood, there are so many nuances associated with getting that started. Where we with the rules and regulations, and even when you drill down to the services, if you have too many men in a house and they're on some type of service, they may not get the services that they need, or because access to food, for example, if you have food stamps. Some of the houses or some of the areas will not let you have a certain amount of people in the houses and still access food stamp services because it's the same address. So I understand.
It gets complicated.
It's yes, to say the least, it's very complicated, and I understand Tom's frustration, which is why I don't work for the government anymore.
But you, when we spoke earlier, you told me you have had some real positive encounters in your work currently when you go back into situations where you're interacting with the judicial system, with law enforcement, and people who you had seen when you were not in a good place, and now they see you, and you think that really will inspire them to give others, a bit more of a break, or be more understanding in how they deal with them, I guess.
It definitely does. When you're dealing with first responders or law enforcement, if you're reversing an overdose or if you're locking someone up, and then they come back and you actually see them doing well, it really resonates with them, because they said it makes them feel like they've done something in the community, because typically law enforcement will see us at our worst, not at our best. And what you were speaking of, and I'm very open about everything in my personal journey, is that I had my children taken away from me at one point in time. And there was a lot of domestic violence in my relationship with my now ex-husband, so we're in a good place now. We co-parent well too. But going back into that community and working within the behavioral health system, and law enforcement officers seeing me and interacting with me on a work level, or Child Protective Services seeing me and interacting with me, and me having my children back, first it makes their job worth it. They know that they have a purpose, that something good came out of this. And second, it allows them to see me in a different light, that just because I'm in recovery, that doesn't define who I am. I am a mom. I am a citizen. I'm a constituent. I'm all of these things. And recovery has just been the process and the catalyst to get me there. So it's really important for us as people in recovery to expose ourselves to the individuals that we've interacted with during crisis.
Right now, we're going through a pandemic. It is something none of us have dealt with before. How concerned are both of you about where we're going to end up whenever this is over, when it comes to addiction, substance use disorder, all sorts of brain health challenges?
Yeah, I'll start. I think the statistics, are starting to come in they're bearing certain things out, but very intuitively, kind of when people isolate, bad things happen oftentimes, both from a mental health perspective, from a, abuse perspective, from a, substance abuse, perspective, and, forced isolation is not good.
And we're all isolated right now.
That's right. Yeah, and the thing interesting about COVID, it's very regressive in terms of it, it impacts, economically. So, a lot of empty office buildings in Washington, but a lot of the professionals are still earning a paycheck and working remotely, and they're impacted, but kind of life goes on, and not a material economic hardship to them. But there's a whole host of people who have lost their jobs and have slim prospects of getting other gainful employment. Kind of a very vulnerable population, and that coupled with the isolation factors is going to have negative consequences. And the challenge is, what do we do about that?
Brandee, what has Safe Project seen in the way of actual numbers of people impacted, overdoses, things like that?
So what we have seen, and we've been really taking a look at those numbers, is from May of 2019 to May of 2020, we have over a 50% increase in overdose deaths. Now, we know that the rates were going down, but once COVID had hit, we are seeing them going up again, and at exponential rates, and some states even higher than that. It was really important for us at Safe Project to do an analysis of what we need to do and what we can do moving forward to assist grassroots communities, recovery houses. And it was about us creating a line of communication, because the opposite of addiction is connection. And it's really about us ensuring that there are resources out there and connections out there, whether that be doing virtual platforms, providing virtual spaces for people in recovery to connect, including veterans. So for us, we actually hired more communications people on staff to make sure that we could start getting those messages out, doing environmental scans, and really just touching base with states and communities and saying, hey, what do you need? And obviously the deterra effort, making sure that we have disposal bags in the hands of the communities. So I am extremely concerned, especially for the children and individuals who are early on in recovery, and also the people that have longevity in recovery. This is something brand new to them. They are the predecessors. They are the mentors to the new ones coming in. And it's really, even coming into this room, I was ready to hug each and every one of you, because that's just in my nature. And and the anxiety that came over, because I'm used to going out all the time and desensitizing myself to the anxiousness that I have. And unfortunately, you can feel it coming back up because I haven't been out. So I can only imagine what someone early in recovery is dealing with.
Or what about those who were not addicted, were not abusing substances, but who now increasingly are because of this isolation? That's something that sadly we saw in Howard County as we were giving away food, putting groceries into the back of people's trunks. One of my colleagues approached me and he said, Kathleen, I'm a little worried because I'm seeing more and more trunks that are full of empty booze bottles. And when my husband has gone down to the corner liquor store to buy some wine, we have heard from two different folks who own these liquor stores. They've said, it's a good thing you're wine drinkers because the hard stuff is getting really hard to find. It sounds like people are drinking more.
Well, I mean, isn't that mom life? I mean, when you think about it, my entire Facebook feed is lined up with wine glasses filled because moms and dads who are doing virtual learning are like, they're not used to that. They're not, you send your child off to school, you don't think that you're going to have to navigate that. So it's extremely difficult for people and family members right now and how to navigate all of this. And to me, that's where recovery comes in.
And a lot of people obviously can enjoy a glass of wine or a beer or a mixed drink or
harmlessly,
responsibly.
Right.
But there are folks who can abuse them, and this certainly kind of gives more kind of impetus. The use of alcohol to drown your sorrows in quotes or to celebrate in events or for whatever reason. It becomes more of a self-medication type of process, which can, as we all know, lead to very bad things. And that's alcohol, but there's, unfortunately, a variety of other drugs are widely available.
Tom, the issue that you're very concerned about, having a safe, supportive, having safe, supportive housing for those who are in recovery. How worried are you about the pandemic's impact on that? Not only, I guess, for people in recovery, but across the board. I was watching, there was a fascinating report on PBS just the other night, and they were interviewing therapists, and this therapist was doing telehealth with his patients, and he said, I'm really concerned. He said, because the first session that I did with them, the telehealth session, they'll be in a nice house. Then a couple sessions later, they're in a small apartment. Then some of them, a few sessions after that, they're in a car. He said, I'm really scared that the next session they'll be in a tent. And our facilities for the homeless have had to cut back on the housing that they provide because they are very concerned about the spread of coronavirus. So what are your worries right now in the face of all this?
Yeah, some big heavy-duty issues, right? Housing. In a lot of cities, Washington, we're here. Other major cities is very expensive, and challenging for people to have kind of safe, affordable housing. With or without substance use or mental illness, just kind of people in general. And how do we create communities where there is affordable housing in a community? To create that diversity within a community is a complicated issue, and I have no opinions on how to solve that problem, but I understand that it does exist. In my case, what I've chosen to do is focus more on a local level. In my local level is kind of one house with 6 guys in it, and maybe 2 houses with 12 guys in it, and try to provide a meaningful experience in their recovery. A lot of help for a limited number of people, rather than taking my efforts and spreading them around kind of broadly. But it is a broader issue in terms of general housing.
Mm-hmm. Brandee, what is Safe Project doing in this area, and how concerned are you?
Well, I'm extremely concerned, as I had said before. I think we're in a better place now than we were initially. But a lot of what we're doing is, opening up our doors or any of the resources that we have available. For example, we've gone around to houses and said, hey, do you need PPE? What do you need that we can help? What can we build as far as a resource cadre for you, so that if you need something or if the floor drops out, that we have your back, I guess you would say, in that respect. We definitely leave what we need to the locals, and we will enhance and assist in any way possible as far as resources are concerned, whether it be thermometers, the PPE, face masks. You may need cleaning supplies, and quite often houses aren't equipped or funded to do that type of, provide that type of service on a consistent basis. So it's up to us to make sure that we do those environmental scans and start building those partnerships with those local communities and teaming up with them to figure out and assess the situations so that we can help further the cause.
Brandee, I was wondering if you do have any statistics when it comes to substance use disorder, in that are people any more or less likely to be in jobs where they are impacted and losing, their way of paying for their mortgage, paying their rent, losing their jobs?
Absolutely. Even in early recovery, when you first came on or come into that process of recovery, it's extremely hard to get a job, especially if you have a criminal history. I don't have statistics off of the top of my head right now, but I have had individuals and friends who have lost their jobs or their schedules have been cut back, and it's been a real struggle. I can tell you personally, I did not start off as an executive director of a national nonprofit. I was a very happy cashier at America's Best Wings, and I could make really good lemon pepper wings. I will say that. But I'm quite sure, based on my own experiences, that others have had to cut back their hours or perhaps even lose their positions. I can tell you in the behavioral health world, we had a very difficult time with peer workers who are people with lived experience in the recovery process, offering outreach and engagement to other individuals who are with substance use and mental health disorders. And they were not our first line of attack, and that was very shocking, frustrating to me from a governmental perspective, because they are your first outreach and line of engagement, whereas if you have a counselor, you may only engage with an individual perhaps once a week through telehealth. The peers are the boots on the grounds, the ones guiding you through that process and assisting you in your recovery process. And they lost their jobs, or they were pivoting and doing contact tracing. So it's a huge struggle, not only in the immediate, but there are long-term effects to it, because if you get backed up on a payment, it's very difficult to move yourself forward.
Tom, what you're doing is so extraordinary. You actually bought this house and you've given it to Mike's place. And so the young men who stay there pay a nominal rent, but it's not very much. And from what you're saying, you're very successful. It sounds like we need a Mike's place in every city in this country.
So when we kind of supply and demand of drugs, treatment and then recovery. Recovery is a long-term process. And before this event happened to me, hey, go to a 30-day treatment program, wham, you're cured, and life goes on, right? Unfortunately, it's not that way. It is a lifelong journey in recovery. And, the statistics are such that, the probability of relapse in the first 1, 2, 3, 4 years, is high, and it goes down, over time. And, one of the, to try to minimize the probability of relapse, creating, strong, social relationships, kind of employment, building communities, and living in safe places is key. And some of the, intuition plus the statistics will tell you that in the research. And so what we focus on is providing that, a living situation.
It sounds like a replicable model.
It is, with one asterisk, is that, housing is expensive. And in order to kind of do it effectively, it requires, some capital, both for the house, and in our case, we have a living group manager who provides, structure to the house in terms of kind of lived experience, someone with, a large amount of sustained clean time, it holds the guys accountable, and serves to operate it. So.
And you're picking up all those expenses right now, correct?
I'm grateful that I'm able to do that, to pay for those. But that being said, throughout the United States and in the Washington D.C. area, there's other housing, providers who do very good things in terms of, housing. But you're right, we need more of them, and it is replicable. It's not a patentable, technology. It's pretty intuitive to run, something like this, but it requires, like any organization, someone with passion to get it up and running and keep it going. But, I mentioned a women's house opening up in Leesburg, Virginia. So the good news here is someone replicating this type of idea.
That's exciting.
Yeah.
So if there were folks watching, we're in Washington right now, so there might be people on the Hill, people at federal agencies, watching this discussion, what would you tell them that you would like them to do? What change would you like to see them make that would help?
So I'm going to be nice. I think one of the changes that I would honestly like to see is that recovery support services are not lumped into treatment. Recovery is a lifelong process. There needs to be sustainability and maintainability. So not lumping that into a treatment modality is extremely important. And I think my second one is paying for recovery houses so that there is an opportunity for replication and expansion.
So there's no money for that right now?
Not right now, not that I know of, unless there's something coming down that I'm not quite sure of. But typically, it's someone as gracious as Tom to step up to the plate. And
Where would that money come from? Is that an HHS function, you think?
Yep.
Okay.
SAMHSA, HHS, yes.
Yeah, I think two observations. One is a lot of the federal agencies are doing very good research into brain science, into understanding substance use disorder, understanding mental illness. We touched on a variety of topics, early detection, young children, et cetera. And I would encourage the government to continue to fund those very worthwhile efforts to try to get us smarter as a nation, and so treatment protocols will be improved. The other observation I would make is I would be very cautious of steps to legalize marijuana, and I know some states have taken positions to either decriminalize it or make it available in some way, shape, or fashion. Tom Mutryn talking, to me there's going to be significant long-term negative ramifications of that, and I truly believe the costs of doing that will outweigh any benefit, the benefit people enjoying recreational marijuana. So that would be my other observation.
I would like to go to the room for potential questions. Anyone here who have any questions, or did we? Okay, we do. Wait, hold on a second. I think we have a microphone for questions. Hold on. No, he's gonna bring one to you, and that way everyone watching on Facebook Live can hear you too. Perfect. Thank you.
Hi. The marijuana issue could probably be a whole nother segment, right? Because I don't really smoke pot or whatever you want to call it. But for people with cancer, for pain relief and that type of thing, I've always thought this is a great idea and support that. And so that's why I thought legalization was good. But on the other hand, if it's someone who's, maybe an alcoholic or trying to be sober, and they think they can still do, smoke marijuana on the side as a, maybe because they say they need it, they have a medical marijuana card. Yeah, it's like a real catch-22. And I think, is that what your point is, sort of, that you feel like if we legalize it and continue down that road, it's just going to exasperate the drug issue?
I believe so. Again, sample of one. My own humble opinion, I think the negative repercussions are greater than any societal benefit.
Yeah, it's interesting. I don't know what to say either. I just think it's a good discussion because it seems like a lot of states are legalizing it.
But you can't have one without the other. You could have the medical marijuana use and not legalize it throughout a state.
Yeah, the recreational thing is maybe, like you said, not a good idea.
Brandee, did you have any thoughts on that?
I think there's a level of decriminalization that needs to happen. I do believe for medicinal use that it has helped a lot of individuals, but I also know that for some it can be a catalyst into different levels of using, for sure. I think for me, one of my main issues and concerns is setting the precedent for our younger children, that is the end all, or that they can do that and then remain employable and all of that. There are just so many different moving factors associated with this. And the more I explore it, the more opinion I have, and I will table that from here.
Do we have more questions in the room? Because we have the microphone here. I think we have a question. Oh. Mary Lowe.
This is always one of my favorite questions. If you were the Secretary of Health and Human Services, what one policy change would you make?
Oh, Mary, that's tough.
You both have a new job now.
Tom, you can go first.
So, yeah, you kind of stumped the panel here. I think they're doing a lot of things right. I mentioned earlier, additional funding into kind of research, into brain science, is kind of warranted, and I think that's going to pay off in terms of kind of long-term benefits. A lot of smart people, neurologists, studying the how the brain functions, and as we continue to study that, I think we'll learn a lot more about mental illness and substance use disorder in kind of related topics. So that would be a focus of mine.
I feel like this is the behavioral health of Miss America, right? World peace. For me, it would be on-demand treatment. One of our main issues when we're working with individuals who are actively using is that there's a small, minute amount of time when that individual is asking for help that you have an opportunity to get them into services. And quite often there's a wait time for that, or there's an intake process, and addiction doesn't start at 9 in the morning and end at 5 at night. Addiction typically happens, and when we're looking for help and yearning for help, it's in the evenings and on the weekends and on holidays. So we must have on-demand treatment where there are treatment beds available at all times.
To take Mary Lowe's question from the macro level to the micro level as we close, what would be the one thing that people watching this, average folks in their homes, in their offices, whatever, what can they do to make a difference and help people who are struggling with some brain health challenge, again, be it substance use disorder, traumatic brain injury, post-traumatic stress? What is one thing that individuals can do to make a difference?
Yeah. I'll start. Kind of not to be judgmental. It is. It's not a character flaw. Kind of mental health issues or substance abuse or PTSD, and kind of complicated, kind of issues, and kind of be supportive, accepting, and kind of non-judgmental.
Brandee?
Exposure therapy, I believe in that. Asking people their stories, finding out what happened to them. And once you find out what happened to them and that it isn't a moral failing or a character flaw, you start to get to know people and you start to create that circle of humanity. And it's really important for us to humanize people that are going through substance use, mental health challenges, and getting to know them. So I think that's what you can do, and believing in them like Tom believes in us.
I just want to say thank you to both of you. What a wonderful discussion. Tom Mutryn, founder of Mike's Place, Brandy Izquierdo, Executive Director of SAFE Project. Thank you for a wonderful discussion.
Well, thank
really
you very
appreciate
much.
it.
Yes,
I know we're a few minutes early, but hopefully no one will mind.
Good, thank you.
Before Mary comes up and gives her closing remarks, I just want to quickly thank our sponsors and our partners. Without them, none of this would be possible, the annual symposium plus all the other events that we do throughout the year. So thank you to them. MITRE Corporation, NeuroFlow, Higher Advocacy, Nonprofit Strategies DC, Business Resources Television, LeadersLink, Safe Project US, the Glow Media Project, Armor Down, Mike's Place, Healthy Caregiver Foundation and Women's Veteran Rock, and of course, Project 22. Thank you, everyone.
Wow, it's been some day, and I always love ending with this panel because I think it starts with our families in the morning, which is at the core of everything we all do out of love, and it ends with what we need to be doing in our broader community. One of the things we can't forget is that we're in the midst of a pandemic, But we have another epidemic that we're all still dealing with. And we really need to continue to remind Congress and our leaders we can't ignore the tsunami of mental health issues that are going to be coming. We're already seeing huge increases in the numbers. And in fact, there was a Kaiser family poll that talked about some of the hotlines starting in April. We're receiving 1,000% increase in requests for help. Mental health issues aren't going to go away. They're just going to get worse, and we're not funding them. We're putting millions of dollars to CV-19, but only a tiny bit of that is really going to mental health. So we need to ask our congressional leaders to continue to support the initiatives in the community. Otherwise, we're going to see some numbers that are even worse than what we're already seeing. And we talked about those numbers earlier today. When we talk about the losses from opiate addiction and suicide, if we put those over a year, it's about 120,000. But when we had our folks from the VA here earlier today, they were talking, we need to really think differently about it as a polysubstance problem. We're not including people that are dying of alcohol abuse. We haven't been including them in those numbers. And so when we start looking at other losses within that substance abuse family, it's a little scarier. It's even worse than we think it is. But we had a lot of really good discussion today, and gives me hope. We heard on the importance, two big themes today about education and holistic approaches. We started off this morning about the importance of family and communicating and creating a foundation of change, about the importance of listening, about understanding risk factors in our children, about creating a culture where we teach empathy, about encouraging people to ask for help and creating a trusted environment. We learned quite a bit about polysubstance abuse, about integrating the mind and the soul, about connecting the mind and the body, and about transcendental self-treatment, TST, which is really, I think, going to be a game changer when we look at mental health. We talked about the importance of even more about the mind and the body, and with the creative community and creating a trusting environment to support community well-being. And we learned a lot about making sense. In this panel, we learned more about the importance of a holistic approach, about the importance of creating a structured process to support long-term recovery, about social emotional education and mental health awareness. And it's really important when I think about this, it really does connect with our three pillars within the foundation about education, collaboration, and facilitation. We can't stop educating our communities. But we do some of this because we don't forget about the stories. The stories of Philip, the stories of Mike, the stories of Charlie, of Jonathan, Kevin, Haro, and John Pell. That's kind of why we do these things. And it leaves me with a thought I want to leave everybody with for today. I have a dream, and this is a big dream, that we can build a better path, that we can create and build a better pathways of recovery, not just from wounds to wellness, but to be the best version of you. And so I want to thank everybody today for being here. This was an important conversation.